Hello, Dr. James Bogash, expert in health and longevity, and as a practicing chiropractor. This particular study, although it's about 2 years old, just really resonates true with what I've seen over the years, now 28 years in practice, and from pretty much every other study that asks the question. And it has to do with if you're having back pain, or in this case, neck pain, like, who do you see first? Should I go to my primary care doctor? Should I go to an ortho? Should I go to a neuro? Should I go to the ER? Urgent care, whatever it should be. Like, who should I see first? And before I go into the results of this study, make sure you like this video, share it with somebody you think needs the information, and subscribe to the channel. So that being said, being active on social media and making comments on different things, I always hear, not always, but frequently hear things like, oh, well, there's no evidence that chiropractic works. And, well, yeah, there's no evidence that chiropractic works for hemorrhoids or for, I don't know, balding. Otherwise, I'd have a full head of hair. But you need to ask the right questions. And one of the things that is one of the things to understand is that chiropractic care is not a technique. It's not a treatment. It is a different way of looking at problems. So when somebody comes in my office with neck pain, we're not just going to work on them in the office with soft tissue techniques and exercise and adjusting. We're going to talk about how they might be sleeping, drafts they may have at night, are they exercising, are they an anti-inflammatory diet? All of these things go into the package. And when you look at how DCs treat, the data on whatever you're looking at is the outcomes are just stellar. And and that's without, I have a bias. I think that chiropractors should do more soft tissue work. I think if we did, we would rule the world instead of just adjusting. But that being said, let's get into this particular study. And this was done by the people at Optum, which is a United Healthcare subsidiary, and they are wonderful at data crunching. But what they looked at is new onset neck pain and 770,000 cases of new onset neck pain. Like, that's a lot. And what happened when they saw different, like, who did they see and what happened going after they saw that provider? So the two top categories were chiropractors at 45.2%, and that was the highest number. The next number was primary care doctors at 33.4%. ER doctors, ortho, neuro, those were other groupings or variety. But, so what happens when somebody went to see, or for starters, if somebody whoever somebody saw the first time, so if you saw a DC, you were more likely to go see a DC again. Well, that makes sense, especially if the result was positive. If you went to the ER, you're more likely to go to the ER next time, despite the fact that that is generally a very poor trajectory for treating neck pain or low back pain, with a few exceptions. So what happened when somebody saw different providers? Well, first of all, when advanced imaging, so CT or MRI, if you went to the ER or an ortho or a neurodoc, 30% of you got advanced imaging. That flies in the face of every study, every recommendation about early advanced imaging. Remember, this is a new onset neck pain. And we're not talking red flags here like, hey, I just woke up, intense neck pain, and I'm dizzy and I've got vertigo and all that stuff. If they saw a chiropractor, it was less than 2% of advanced imaging. Chiropractors very commonly follow the research when it comes to advanced imaging. A lot of other providers do not. So what about therapeutic injections? Think epidurals, trigger points, whatever it would be in this particular case. If they saw an orthopedic doc, 6% of them got injections. If they saw a DC, it was 0.4%. So a fraction of the people that saw a DC. Well, what about major surgery? Because these are all the same group. So obviously, like, if there's people that are going to need surgery, they're going to need surgery, right? Well, it really depended on who you saw. So if you went to an ortho doc, you were 3.4% of them ended up having major surgery. If you went to a chiro first, 0.1% ended up having major surgery. That really tracks well. We don't fix everybody, but darn it, there's a lot of people that we can save some surgery and injections and advanced imaging that don't need to go there first. And so who you see as the initial provider really dictates a lot of what's going to happen to your care. And this particular study didn't look at opioids, but there even 10 years later, people who saw a chiropractor are less likely to use opioids. So that being said, even though the study's it's 2 years old, I will post this link to this particular study in the description. Make sure you like this video, share it with somebody you think needs the information, and subscribe to the channel.